Hi everybody, coming up in this video we've got a massive earwax plug in this ear canal. My name is Taylor Green, I'm one of the audiologists here at Audiology Associates.
My name is Rhys Barber, I'm the other audiologist here at Audiology Associates.
So just the one patient.
Just you?
Yeah,
all
just the one
yours
patient
today.
In this one, so it's
Sit back and enjoy my tea.
Yeah, enjoy your tea. It's actually quite a tricky one, as you can see by the length of the video.
Yeah.
It's quite a lengthy one to do. So just make yourself a cup of tea if you want to, a cup of coffee or whatever you fancy drinking. But we got the standard size Zollner tube here. Now the vision is not ideal on this one, and I think I remember saying to Rhys, if you don't want to use this one, I completely understand, because there's just so much hair in this one.
Yeah.
It was quite a tricky one to do, and I always hate these really hairy ones.
Yeah.
What you basically get is where all this hair kind of mats and twists up against each other like this, it kind of glues together within the wax. But what it also does when you try and get a grip with the suction is it almost acts like a mesh, and it sounds like you've got a suction grip, but it's not a full grip. And yes, really
they're tough
to do.
It almost goes, if you put like rebar in concrete, it just strengthens the concrete. It's like that for the wax. You get such a sticky wax, and the wax is really doing its job really well. The whole purpose of wax in your ear canal, protect the ear, right? At all costs, protect the ear. So it's going to be protecting it from infection. It's slightly acidic, so it stops bacteria taking hold, but it also picks up any dirt and debris that enter the ear canal, including
hair.
Chunky bits of hair. And the hairs on the outer part of your ear canal are also designed to stop any dirt and debris from going in. So when you're trimming those hairs, what's happening is you're trimming those down, those fall into the canal, the wax thinks it's debris and picks it up and tries to carry it out, but it can't because it's then stuck.
Yeah.
So this is what happens.
Yeah, we've already got quite a big piece out, actually. Yeah, we've got quite a big piece out. There was a little gap just above the wax there. And it's getting a little bit darker now. You can see the colour difference. This has been in there a little while, this one. So yeah, I'm trying to hold that grip. You can see me moving kind of up and down in the ear canal, and all I'm doing there is trying to detach this off the ear canal.
Yeah.
Because if it's been in there a long time, you usually get like a layer of skin around the ear canal, which basically just holds it in place. It's like Velcro.
Yeah, it's true.
You're gonna try and unstick it first before you can get it out. So they're not easy ones to do.
But what you get as well, sorry, I'll put my tea down, is where the hairs are all embedded in the wax. And as Taylor said, they crisscross over one another. So if you imagine, if you're using something like a suction, everyone's got hoovers at home. If you try and pick something up off the floor, like a piece of card off the floor, if it covers the suction tube, you'll be able to pick it up really easily. Yeah. If you're trying to pick something up that the air can pass through, you can't pick it up so easily, and that's what happens with the suction. The hair sitting on top form almost a barrier, like a mesh, and then the hair the air can pass through the hair on there, which makes it much harder to pull out. So there you go. So that's what happens.
That's what we should do. I just thought of something.
I can't do tongue. I can't. I'm tongue tied, so I can't even do. I can't. Tongue twister would be difficult for me, I think.
We'll have to read loads of tongue twisters and try and get through them.
We should do something like that. We haven't done anything like that for ages.
No, we haven't.
No.
So it's getting there. It's getting there slowly. We're starting to get all this kind of peeling away. It's breaking apart in little sections at the moment, which is fine. A little bit is better than nothing. It's just that I don't really want to be using oil because I don't want it to. No. I don't want it to interfere with my vision.
You've got a teeny tiny gap at the top there. I wonder whether you'll switch. It depends on this next section. If it gets stuck, I reckon there's going to be a Rycurette coming in there.
Potentially.
No, it's moving now. You don't need it. You got it, look.
I did. I see. This is obviously one that I did afterwards. I thought,
in fairness, I edited 2 of yours this morning. I had beautiful wax shots. Oh, they were amazing. Nailed it.
I can do it.
You nailed it.
I can
do it all the time.
You can just shout to me all you want to. I will keep forgetting to do it.
I'm going to go, right, I'm going to write on a bit of paper, wax shot, right? And every
Just
patient
stand
you
behind
have,
the
I'm going to
patient like
stick it to the side of the patient's head for there. So you're taking it out, you can see wax shot.
Or just come in the room and just stand behind the
Just
patient.
stand behind
paper
you.
like this.
Just shake my head every time you don't do it.
Go back in now and get another one.
Put it back in and then pull it back out again.
Oh, fab.
I know what it's like though, especially if you've had a tough wax removal. Because there's a couple of mine I've put in. I thought, oh, I didn't hold the wax. But I remember at the time thinking, oh, this is just non-budget. And then you get it out, like, yes, it's gone. I forget to hold it there.
I've given in. I've put a little bit of oil in.
Well, it'll help.
Yeah.
It's always that catch-22 with the haze, isn't it?
Yeah, and this deeper section as well. It's quite likely the patient has, tried to use a little bit of oil. I mean, probably not a great deal looking at how hard this is, but I was just going to say, when you've got a complete blockage, the wax usually only affects like the first third of the of the whole length of the wax plug. So that's basically what we've got now, is this really hard kind of, well, it's all stacked down in front of the eardrum. You can see the ear canal is starting to come through either side, but it's just nice. Getting that moving. That's the biggest problem, is holding that suction grip.
Yeah.
The oil is working its way nicely. I wanted to try and avoid getting the suction on that oil, just to try and get it seeping underneath. I can't remember if I do use a manual tool yet, actually.
It's doing the job though, isn't it? It is coming. It is coming. It almost looks like a little hairy caterpillar. Doesn't it?
Yeah. It does, yeah. Like those, I know what
you're
the
other ones,
I
can't think what they're called.
Yeah, I don't know which ones they are.
But when I was going to say, when you got hair, sometimes you're lucky you can grip it with a set of forceps.
Yeah.
Pull the hair, and there's just enough hair embedded into the wax, it'll pull the whole thing forward.
That's going to break away, I think, isn't it?
Yeah, that's not what happened here, but sometimes it happens.
Sometimes it comes away nicely. Trying to get those jaws either side of that plug now. No, you can see it straight away. It's not.
Just almost scraping along the surface, isn't it?
Yeah. Okay.
But clearing some of the hairs will help.
Yeah, it usually helps get a better grip.
Yeah.
Again, sometimes it'll pull a little bit of the wax away as well, and you'll get like a flatter surface. You're able to get a much better grip on. Because
with that one as well, you had that knobbly bit right at the front there. As you try and pull that around that S-bend we were talking about a couple of videos ago, it's going to hit the wall and you're not going to be able to pull it around.
This is not doing much. I was kind of hoping that there's some of those hairs were going to like be still attached in the centre of that plug.
Oh, I don't know.
I can obviously see some movement. I can obviously feel a bit of resistance there as well. There we go. I got that little gap there just at the top now. So I'm just going to, without pushing this any further in. There we go.
Create a bit more of a gap. That's the way. A bit more of a gap.
Ooh. Oh.
You got it. You got it moving.
Yeah, almost there. We always say to the patients at this point, there's going to be a little bit of pressure now, especially with these harder waxes and when there's not much room.
Yeah.
We got to try and roll that through. So I've switched the tool around to the right hook. Yeah. I keep getting confused with the names of these. This is like a double-ended tool that we use. It's got the right curette on the one side and then the right hook on the opposite side. We just flip it over.
You like this one, the double-ended tool?
Yeah, the straight one. You use the crooked ones.
I prefer I prefer the 45 degree. Oh, what do I say? 45 degree, but I prefer the angled ones.
I can see why, because I can see why when you when you got it in the right position, basically. Oh, this is a tough one to do.
Difficult now because you're into that territory with the endoscope, where you're beyond the hairs on the outer part of the ear canal, so you're looking through the endoscope through the hairs, but you can't get closer with the tool because they're gonna collide. You're gonna chopstick, which is where they hit one another and click like this.
Yeah, there's obviously something that's holding this in place, because I couldn't get this around that corner.
It's the wax fairies.
It is.
They're all inside holding on to it like this with their hairs on the inside.
We've been saving this up for years.
Yeah. Do you think they'd be wax fairies or wax goblins?
That's got to be goblins.
You're right, just go wax goblins. I was
leading.
leaning more towards wax goblins. There you go. Let us know in the comment section, guys. Do you think
Hey, we watched the Super Mario movie on the weekend. Me and Theo.
Was it good?
Not the new one, the old one. That's
Oh
really good.
yeah, I caught the second half of that with Theo. I did catch it. It was on TV.
It is.
Oh, that's a chunky one, isn't it?
Oosh, dark as well. Look at that, nice and clean.
That's a
afterwards.
lot clearer. I thought. Oh, that is a chunky piece. So just that last piece that came out was a 1.5 centimetre. Yeah, and
it's
wide
really
as
good.
well.
Yeah, got about
Girthy.
4.5 centimetres roughly there,
Yeah.
just over 4.5 centimetres. So yeah, quite a piece.
Guys, thank you so much for watching our video today. If you do enjoy the videos, don't forget you can always like, heart, share, follow, and subscribe for me. Make sure you smash that notification bell as well, guys. That way then you get notified every single video we put up. One little note, which I haven't put on the subscribe videos, from the 5th of May, we are not going to be putting the videos, the Waxman videos, onto Facebook and Instagram. We have a little 8-week break because there's a bit of an algorithm issue going on, which means our videos just keep getting flagged for loads of stuff all the time. So we're trying to sort that out. So we're going to give that a bit of an 8-week break. They will still be available on YouTube and TikTok though, so you can still check them out there. So just giving you some heads up, just in case you don't have a YouTube or a TikTok account, you can check them out there, all right? But guys, as always, take care of yourselves.
Take care of your ears.
And take care of one another. Myself and the lovely Mr. Taylor Green. We'll see you again soon. Bye, everybody.
Bye-bye.